Good morning, everyone. I'm so excited to be here. I want to thank Nancy for that welcome around compassion. As you will hear today, Dr. Crespo and I are here because we have a compassion approach to increasing the wellness of young people, and oral health through vaccination and oral health integration, medical dental integration is really a passion for both of us. I do want to mention that I have changed my career, and I am now a senior independent research consultant for adolescent public health, including this. Thank you.
All right, this is our disclosure slide. I don't know if you can read it from back there, sorry. All right, so we want to talk about the most important fact, which is that oropharyngeal cancers linked to HPV are rising. We know that prevention remains possible with timely vaccination. We have an effective vaccine that has been available in the US since 2006, and nearly 20 years later, we continue to really falter in getting to herd immunity, which we estimate is about 80% of adolescents need to be vaccinated in order to decrease these cancers for these kids as they grow. We know that the pandemic didn't help, that there were significant stalls and declines in vaccines, and we're still kind of crawling out of that today. And though most other vaccinations for adolescents have rebounded to their previous rates, HPV continues to lag behind. We know that disparities persist in multiple arenas. What's interesting about HPV-associated oropharyngeal cancer in particular is actually there's a reverse disparity. It's actually more common in white men and white females. Cross-sector engagement is something that Dr. Oliphant and I are very passionate about. We know that no one can do this work alone. We need everyone to be working together to try to improve these vaccination rates and to, again, prevent cancer in these youth. And we know it's a burden on oral health for people who are suffering with HPV-associated oropharyngeal cancer and for the oral health system. Dentists actually are more likely to recognize these lesions and to refer patients, unfortunately, before physicians. That is something that in my other life I've worked on with trying to teach medical students how to do a complete oral exam, because that is something that medical education training is really lacking, is trying to help people do a complete exam as opposed to just look at tonsils, which is what most residents, students, and physicians are looking at. I had no idea that this screen was going to be so far away from you, so I apologize how small this is. But basically, this is information that was just published in August of 2025. It is a cross-sectional survey that was done across all of the states in the US. And what they were asking was basically, were people aware of HPV? Did they know that HPV was a virus? Had they ever heard of HPV? And unfortunately, from your seats, you can see red bars, yellow bars, and then there's some kind of navy blue and gray in between. I want you to focus on those colors because the kind of brick red bars are states in the Midwest, and the yellow bars are states in the South. And what they found was that overwhelmingly, states in the Midwest and South actually seemed to, people there were less aware of HPV. On the right-hand side, the question was, were they aware that there was an HPV vaccine? And unfortunately, as you see with the states closer to the top of this list, in South Dakota specifically, which is the top line there, almost 60% of people were unaware that there was an HPV vaccine to prevent cancer. And that's going to become important when I talk to you about the states that have the highest rates of oropharyngeal cancer. Excuse me. I'm going to need a glass of water. It's right at the table. I'm just a tiny bit under the weather today. I apologize. This is another teeny tiny slide for you people. Sorry if everybody's got their readers. But basically, these questions were people in these states aware that HPV causes oral cancer? And on the right-hand side, whether HPV causes cervical cancer. Even from when you're sitting, you can see that in general, more people were unaware that HPV causes oral cancer as opposed to cervical cancer. I do think the public health community has done a good job with orienting people that HPV is very well associated with cervical cancer. but unfortunately not enough people understand the connection between HPV and oropharyngeal cancers, which we're going to talk more about. This is another teeny tiny slide. But even from where you're sitting, the most important kind of square here is this left upper graph here. So this compares two time periods from 2001 to 2003, which is the darker line, and then 2015 to 2017 is the yellow line. And it's basically cases of oropharyngeal cancer. And what you will find, this first box here is white men. Nancy, is there a pointer? I'll just point with my hand. Okay. Okay, that's okay. It's no problem. It's a multimodal presentation. So in this upper left-hand corner, you will see the tremendous rise in those two time periods. So in 2015 to 2017, the rates in white men for oropharyngeal cancer increased significantly. They were about 3 times higher than they were in 2001 to 2003. And this is where the largest growth has been seen. You can see compared to the middle graph here is black men, and the far graph is Hispanic men. And certainly those increases were not seen in those groups. On the bottom here, I hope you can see on this left-hand side, this first box here is cases of oropharyngeal cancer in white women. And there was also an increase. The shift in white women was around age 55 is the median age of diagnosis. For white men, it's about 60 years of age. But you can see that the graph starts early and ends early, so the range of ages is what we've seen with HPV, which is it can really affect younger people. And we're going to have an example of that coming up. So as I talked to you about the lack of awareness of HPV vaccine and the lack of awareness of the connection between HPV and oropharyngeal cancer, this is a representation of the geographic burden of oropharyngeal cancer cases in the US. And again, it compares the same time period, 2001 to 2003, with 2015 to 2017. And from where you're sitting, you can't see the key on the bottom, but basically know that orange and pink are 8 to 10 and 10 to 12 cases per 100,000 people, compared to what it was previous, which is about 6 to 8 cases per 100,000 people. So there was just a very significant increase. And if you can see from where you're sitting, the concentration was in the Midwest and South. And that was true for men and for women. So again, something very significant is happening. There's a little bit more concentration in areas of the country that include the Midwest and the South. And what we can take from that is that we probably need to do some better education in those areas, some more public health communication to really kind of alert the public of really what's going on. God bless you. What they found was the states with the highest incidence of oropharyngeal cancer just by percentage. South Dakota was actually the highest with 6% increase over that time period. And if you remember, South Dakota was the state that had the highest lack of awareness of that HPV vaccine. These things aren't directly related, but there's probably some association. So again, more education for the public could help change this trend. But unfortunately, you see Minnesota here in this states in the Midwest with the highest rates of increase in oropharyngeal cancer, and again, states in the South. So what is the situation in Minnesota? We know that HPV vaccination series completion in Minnesota is about 69%. And I want you to know that for the other adolescent vaccines, we have greater than 90% coverage. So that means for kids getting their tetanus booster, getting their meningitis vaccine, and getting their, anyways, all the other adolescent vaccines, we do really well with those. So we know that kids are coming in, kids are getting their vaccines, but they're not always getting this HPV vaccine. And that's really where we want to do the most work. Nationally, the HPV series completion lags behind other states, and there's a wide variety. So we know it's about 62% in 2021 of vaccine completion, and that does vary because if teens are vaccinated under 15 years of age, they need 2 doses. If they're vaccinated on their 15th birthday or older, they need 3 doses because the vaccine is more immunogenic when given earlier. So most practices have tried to shift down to age 9, which is the earliest that you can give HPV vaccine, and we know that it's extremely efficient in making those antibodies that will be long-lasting. So there's been, certainly at Hennepin, we've changed our vaccination age down to age 9, really trying to get it done earlier to get them completed before age 13, which is what has been shown to be the most effective. And this is, we think herd immunity can only be achieved when we have at least 80% vaccinated. This middle data point, about 62% of national completion, unfortunately represents a wide differential. There are states like Mississippi where only 40% of adolescents are vaccinated and completed their series for HPV. And then there are states like Rhode Island where greater than 90% of their adolescents are vaccinated. That has a lot to do with Rhode Island having a school requirement for HPV vaccine, and that's really what motivates most parents, is when it's required by school. Unfortunately, the US is being left behind. Other countries around the world have made tremendous strides in getting kids vaccinated and preventing cancer. Some of the most exciting countries to have done this, Australia is where the HPV vaccine was discovered. They started a vigorous vaccination program in schools in 2007, and they have greater than 90% coverage of their adolescents there. Scotland, which has an area the size of Minnesota, started a vigorous vaccination program in 2008. They also have greater than 90% coverage of their youth. And I'm going to show you some very exciting data that they've been able to show about basically the near elimination of cervical cancer in their vaccinated females. Rwanda had a public-private partnership with the vaccine manufacturer, and they were able to get greater than 90% coverage of their adolescents. So it can be done, but it requires better infrastructure and just more advocacy. The US has been trying for years to try to improve our vaccination rates by doing things like having standing orders in electronic charts, banners that remind providers to use this opportunity to vaccinate kids. What we've done, I apologize, my throat is killing me, but what most people have done, again, is number one, shift that age down to age 9, and then use every opportunity to vaccinate a kid. So if they're there for a sore throat, look at their vaccines. If they're there for a checkup, obviously give their vaccines, but really using every interaction with the health system to go ahead and try to get those kids started or completed. And a lot has been learned. We know that policy makes a big difference. Again, those states that have school requirements are much more effective in getting these kids vaccinated. I was the past president of the Minnesota chapter of the AAP, and I wanted to try to make some vaccine changes. That was just a couple years ago, and I was clearly communicated that it's not going to happen here. This isn't the time. There is no political appetite to really work on a repeal of personal belief exemption for kids in the state. But other states have done repeal of personal belief exemption, and unfortunately we haven't here yet, but there's always hope, maybe tomorrow, maybe next year. This is another teeny tiny slide. Know that all of our slides are going to be available at the end of this presentation. This slide is worth taking a peek at because this is how Scotland was able to do their vaccination program. They had a dual track of a vaccination program and a surveillance program. And they're able to do that because they have socialized medicine in Scotland, so they can follow every interaction that patients have with the healthcare system. So they started in 2008. I won't read you all of them. They started with the original bivalent vaccine and eventually went to the nonavalent vaccine, which is what we use here in the US, which is Gardasil 9. So they had many iterations of it. And then simultaneously, they were doing a surveillance project because for cervical cancer, we're screening people. So they were able to show in 2016, just 8 years after they started their vaccination program, they were able to see their evidence of herd immunity. So there was already a decrease in the HPV types that were present in the vaccine. They started to see that in their screening of their population, already those virus types were disappearing. And to get to the end, in 2023, they were able to show their first evidence of the HPV vaccine impact on cervical cancer, which is what's coming next here for you. So this was the kind of mic drop presentation last year at the International Papillomavirus Conference, which Scotland was able to show that there were 0 cases of invasive cancer in their girls who were vaccinated at age 12 or 13. 0. And that is something we should all be striving for. So I'm thankfully going to stop. I'm going to let Dr. Oliphant take over.
So there was a collective ooh and ah, and I hope there was here too, and we hear that because it gives us great hope. And as we lead with compassion and hope, we can make a big difference. So let's talk about how we might do some of those things. So we know that education and advocacy makes a big difference. There's so many ways to do that, and there are so many ways that we still have opportunities to do that. So first of all, I'm a fan of peer-led education. Peer education has been around forever. The quality of the education is what's most important. So one of the things we can do with our youth and on our college campuses for vaccine-eligible young people is to teach them about the cancer prevention aspects of the HPV vaccine and help them understand that as soon as they can consent to that vaccine for themselves as an adult, that would probably be a very good idea. They can also teach their parents and their guardians about the importance of getting that vaccine and advocate for themselves. For those of you who have young people in your life, you know they are good advocators. We can connect to that EHR vaccination prompting that is available to all of us. And I would hope that all of you who are working in the oral health setting could apply that as well. You too can be the prompter, and we'll be continuing to talk about that. We can also think about some story-based medicine. We saw a story at the very end here about how these stories are very impactful. We need our public to be impacted as well. We know that the anti-vaccination movement has been very strong around their stories. We have equal stories as well, which we will end with, which we will show you at the end of the slide. And video-based messaging goes along with that. When we think about some of these stories, not only are we talking about the patient perspective, but we're also talking about the provider perspective and giving that strong recommendation. I would do this for my child. I would give this to my grandchild. I would give it to my niece, my nephew, my next door neighbor. Whatever it means in your connection with youth is an important aspect about making that strong recommendation we'll talk about in the future. We also have opportunities with public health, with schools, and other oral health team collaborations, as we just heard of in our first presentation, to make that wraparound recommendation as well. When we're all working together, not only to recommend, but maybe even provide the vaccine on an on-site basis, we make great strides. And then again, thinking about the recommendations, which we'll talk about in a minute. I'd like to introduce you to Steve's story and give you a chance to think about the impact that the preventive aspect of HPV vaccine could have had for Steve. Hey. This is always a challenge around getting the microphone to work.
Don't hear about young, healthy males getting cancer. I didn't expect this to be how we started our marriage, jumping right into the tough stuff that couples 10 years down the road deal with.
Steve had a oral tongue cancer, and he presented with a lesion or a sore on his tongue that had been there for several months. At the present time, we don't have very good screening techniques for the diagnosis of head and neck cancer.
They performed the neck dissection at the same time that they removed the tumor. You can see the scar right here.
Unfortunately, there's lots of consequences to the treatments that we give our patients. These are often consequences that may have lifelong implications.
We go on a liquid diet for about a month afterwards. I lost about 25 pounds. I like to run, I like to swim, I stay pretty active, and I mean that was just, I couldn't be active during that time. Getting cancer can seem like a very personal and lonely thing. The more that
these usually tend to occur in the oropharynx, which is an area of the base of the tongue, and the tonsils. We've seen over the last several years a significant rise in the incidence of HPV-associated head and neck cancers. We know that the vaccine will be able to prevent the vast majority of those cases.
Just really want people to vaccinate their children, because there is still a chance someday I'm going to raise my children alone, or that my husband will die at 50 instead of 80 because the cancer will come back.
So it's really important that we advocate for the vaccine to be able to prevent these cancers from occurring in the first place.
He's my person. You know, whatever this life brings us moving forward with this diagnosis, we'll tackle together. But I wish that we could have prevented it before it ever started.
You don't usually.
Sorry about that. Oh, no, there's an echo. Can you deal with the echo? Are you hearing it?
I think because that was, do you want to undo?
I just turned it up.
Oh, didn't do anything else. Sorry.
All right. Oh, one of me is enough.
How is it now? Retry.
Hello? Okay, that's three of me.
That's not our system.
Okay.
It's here, like a Zoom call open or
Yeah.
recording.
How's that? Want to try that?
Hello?
Okay.
Okay.
Thank you.
All right. So thank you for listening to that story. And as you can see, this is a very impactful cancer, right? None of us doubt that. I have a family member who just went through this, and I would not wish this on anyone. Just talking even about the weight loss is such an important element of it, because it is so difficult to sustain oneself when you have that extreme weight loss that goes through. And the lasting effects. In the United States, if you're lucky enough to get care, you will live, right? That's not true internationally everywhere. But as you saw in Scotland, they're doing so much better than we are, and we can do better too. One of the things we wanted to talk about is the influence of our own perspective on whether we recommend the vaccine or not. And this is an interesting study here. In this study, they took dental providers and medical students who had either been vaccinated or not vaccinated, and looked at some likelihoods about their perspectives around recommending the vaccine. And as you can see here, if they had been vaccinated, they were 5 times more likely to recommend the HPV vaccines to friends and family. If they had been vaccinated, 2.7 times more likely to recommend the HPV vaccine to patients. And if they had been vaccinated, 2.4 more times likely to advocate for HPV vaccines. So all those young people that are entering our professions now, those that have been vaccinated are our allies. And it's important that we as advocates for the HPV vaccine are talking to our allies here, because we know it has a trickle-down effect. So what can you do as oral health professionals? We can certainly work with our with our professional teams and our crossover teams, the American Dental Association, and other kinds of professional organizations are a big support of this. As you know, we have from the American Dental Association a statement that we should be advocating for this. We can work with social media. We can use stories, as we just saw. And we can also work with some influencers, such as mommy blogs. One of the things that's been quite successful in some areas is to use parental stories. Quick wins always come from a quick intervention in the dental visit. These can come from a brief and strong recommendation. So you giving a brief, strong recommendation for the HPV vaccine makes a big difference. We can also have lots of takeaways for our patients in our clinic settings and in our community health settings. Today we have the American Cancer Society of Minnesota here today, and they have multilingual HPV information fact sheets for families and caregivers, and I would recommend that you connect with those. And you can also, of course, flag charts that for our vaccine-eligible age patients. And that will help us all remember to give that prompt, that strong recommendation. Partnerships we've already talked about. It's really important that we do that. If you're fortunate enough to work in a co-located clinic like a FQHC, these are elements where we can do that warm handoff, where we find out a young person is not vaccinated, and we give the warm handoff to get them vaccinated right then and there. And then, of course, looking at other kinds of events that are culturally specific, culturally engaging, and community-based. You might not know what kind of thing you would say. What should I say? So we provided a 30-second script here. For those of you who've seen young people, or those of you who have young people in your life, you can say things like, has Paula been vaccinated for the HPV vaccine? I strongly recommend the HPV vaccine. It prevents cancers, including mouth and throat cancers. A lot of people can actually relate to that because they understand what they've seen when they've seen the disfiguration that can possibly come with the treatment of these. It's safe, effective, and most protective when given now, 9 to 12, as Dr. Crespo mentioned. Would you like me to connect you to a nearby option or help you schedule that vaccine visit? We want to keep it brief. We want to be confident. We want to talk about our own experience, that we would give this to our own children or the caring connected youth in our life. We want to normalize this vaccination. We want to help with making that warm handoff. And we want to invite questions. This is not about having a debate. We're not debating about cancer prevention, right? We don't need to do that. So here is our call to action for all of you in our YouTube audience and all of you watching today. We want you to integrate HPV messaging into every eligible patient and parent interaction that you have. They're right there. We could prevent cancer in that young person if they get vaccinated. We want to build those partnerships across our community, whether it's with schools, public health, or oral health settings. We want to advocate for equitable access to HPV vaccines in all our communities. And if we do that together, we can create a cancer-free future for our youth. We can be like Scotland.
This is super simple. Ready? Check it out. Boom.
Hey, dude, thanks for remembering that vaccine's a game changer. Way to go, you. No, way to go, us.
Hold on. Are you me?
Yeah, 20 years from now. Yeah, it is weird. But thanks a lot, pal.
Wait, when is this gonna...
Whoa, sooner than you think.
Cool.
So that was that was an example of what our future selves could thank us for. And we want you to be part of our future thanks, right? So today we're going to give you an opportunity to practice. Nancy, could you give me a time, how much time we have left?
Let's do, you guys are done at 10:10, and it's 10:02.
Oh, we have.
We just want a few minutes for questions, because we'll
Okay.
probably have them.
So we want to give you a couple minutes just to write down on a piece of paper, I don't care, any scratch papers of paper, or even maybe not even write it down. I'm not a writer myself too much. Turn to the person next to you. Practice that 30-second recommendation. How would you say it? Think about the young person or maybe even a young adult. As we know, this is a vaccine that can be given to young people, but if you are between the ages of 26 and 44, yeah? I always get the age wrong.
I'll just clarify.
She's going to do it.
The vaccine is approved between age 9 to 26, but for 27 to 45-year-olds who haven't been vaccinated, there is a recommendation to discuss with their physician whether they would benefit from it. So really, you could be talking to patients from age 9 to 45.
Dr. Crespo and I talked about that many times. I still get it wrong. Anyway, so please turn to the person next to you, write it down, however it works for your learning strategy, and I would like you to practice a 30-second recommendation. Giving you a 1-minute warning, and I'm also looking for a brave person in the room who would stand up and give that recommendation. All right, only due to time, so that I can be respectful to our next presenters, am I going to stop you. I'm looking for that person in the room who's willing to be a national or international HPV strong recommender, because remember, this is going on YouTube. Who's willing to do it? Please. One person. All you have to do is stand up and say, "It's me." Come on. Please. Thank you so much.
Okay, so we were talking about motivational activity. Say that.
Do you mind coming up?
Yeah, I can come up, sure.
So we can get, good. We can get it recorded.
Okay. Oh, all the way up.
Yeah, look at this. Now you wish you would volunteer.
Hopefully you can see me over the podium. So we were talking about motivational interviewing and how there's evidence that motivational interviewing helps. So we said, rather than kind of making people feel like backed into a corner, like, you need to get the HPV vaccine, we'd say, do you know much about HPV and that it is related to throat and mouth cancer? And then wait and see if the patient says yes or no, and then say, do you mind if I share a little bit today? And then I like the quote, I strongly recommend it because of the risks of throat and mouth cancer. Can we help you get resources, or can we help schedule that appointment?
Thank you so much. Thank you for helping us see that that's a possibility. So as you know, we are huge advocates for this vaccination, and we are looking for everyone who can be an advocate. So we talked about all the people that can be advocates, and I happen to know we have another person in the room who could be an advocate here. And Dr. Crespo and I have launched some new research, which we think is probably the first of its kind, given our research experience here. And we are looking at orthodontists and orthodontist assistants to be trusted messengers around the HPV vaccination as well. As we found in our research, about 50 youth per day are often seen in the vaccine-eligible age within a orthodontist setting, and there's a giant gap between the number of vaccine-eligible youth that are sitting there, getting care, and the amount of information that our orthodontist assistants and orthodontists know. And we will be presenting this at the IPVS conference 2025 in Thailand. And so please watch for more information and continued advocacy from us among this group. And please reach out to those groups, those orthodontists and orthodontist assistants that you know who can be advocates for this HPV vaccine. So our final messages here is that we have a room full, a nation full of potential trusted messengers. These are orthodontists, orthodontist assistants, dental hygienists, dental assistants, and dentists. And our research has shown us that they are willing to talk about the vaccination given the right education. Some oral health providers are seeing many youth in vaccine-eligible ages, and it's an opportunity that should not be missed to recommend the HPV vaccine. Countries like Scotland have gotten it. We're still working on it, and all of you can lead the way. And together, we can beat these HPV-related cancers. What we hope today is that each one of you will take one of the stickers we provided on your table that says, do something today that your future self will thank you for. And in that, we mean advocate for the HPV vaccine, whether it's telling a parent or a friend of a parent that their child should be vaccinated, or it's that young person in that dental chair, or it's in some other setting. Thank you.